It's a great honor for me to be able to give a report concerning this sport club for health guidelines. In fact, firstly, I would like to thank Dr. Pekkoja, who has been working here in the role of steering committee from HEPA Europe network. I emphasize this approach because there is a scientific frame is really crucial for this guidelines. However, important is to recognize that in Europe you see these sport clubs are really backbone of this, let's call it ordinary sports. However, in the coming future, you see this role of sport clubs in the field of health is really important, crucial. And that's the reason why these guidelines are important. Firstly, I like to inform you about this team. It was working in Helsinki, you see, last year and produced these guidelines. 7 of those people are here in this conference as well. My presentation actually has three topics. First, you see this framework, and then some basics concerning evidence-based approach, and then something about these guidelines. As you see there, firstly, the concept is important in terms of opening understandable discussion between different countries with having different background in organizational background, and so, and terminology as well is important. So I say some words about that. Then you see this concept of civic organization in general, and then sport clubs as civic organization. What it actually is. So some report about that as well. And then you see this health effects of physical activity in different sports. When we talk about sports clubs, you see this not only general knowledge concerning health effects, but you see health effects of special kind of sport is crucial there. Then when we talk about sports club, a really important part of that is social capital. And then finally, you see the sports clubs as health-oriented organization, what it means. This promotional concept first. It do not make any sense if we don't have, you see, a kind of open view what it means when promoting health in terms of physical activity. Firstly, you see this. I would like to underline this physical activity promotion concept. Secondly, you see this health-enhancing physical activity promotion, and finally, health promotion approach. It's really important to recognize what kind of instrument we are using when promoting health and using this sports clubs context there. As you see in the physical activity promotion programs, sport club might be even independent activity provider there. However, when we go to health enhancing physical activity promotion, though, you see actually it's a kind of process where sport clubs are team player, and there are many other parties doing that. For example, healthcare organization can recognize the physically inactive people, and then we have the team which are doing that. And finally, when we talk about health promotion, sport clubs might be the partner. When we meet these physically inactive people, for example, perhaps physical activity is not the first one what they need. It's question about nutrition, question about alcohol abuse, It's a question about non-smoking and so on. So what kind of roles sport clubs might have is very important to know. In the morning we were able to recognize, you see, this Danish traffic lights. Here are the Finnish one. And when we recognize Finnish adults, you see, there are 39% of Finns are about, you see, they fulfill the recommendation of this, so that in terms of health, they are exercising enough. And then about 30% are belonging to the tribe of physical activity people, however, they don't exercise enough in terms of health. And then we have here, you see, this red line. Those people who are physically inactive. And then, to return to this concept, I think that when we talk about this red light, so mostly the approach is health promotion, not the physical activity promotion only. Then you see sport clubs as a civic organization. It's especially when we have so heavy attitudes concerning sports clubs' role in sports. It's important to recognize what is this civic organization. So from my point of view, it seems to me that most of us seems to think that the sport clubs is a closed system. They were established about 100 years ago, and they are still dealing with the competitive sport only. However, these clubs are not living in the vacuum. You see, they are recognizing this kind of, you see, political pressure concerning physical activity and health, and so on. There is, you see, there is if you read this one, the rise of health ethos has increased the readiness of the sport clubs to health approach. So it is important to recognize that the sport clubs are really great opportunity to go forward in terms of health. Then you see the special effect of physical activity in health concerning different kind of sports. In sport context, it is important. For example, for me as a basketball player, it's very important to know that earlier I thought that it's only fun. Now I know it's healthy as well. But I don't, for example, volleyball, it has really good influence and health as well, but I'm not a volleyball player, I'm a basketball player. I'm interested in basketball's health influence. When we talk about, you see, sport clubs, and they have special kind of sport, it's important to recognize this part. But what kind of physical activity, what kind of health influence has my sport? Then you see this social capital. Actually, this is made, perhaps we can underline this social purpose, social networks, this social capital that are used by sport clubs. It might be even the main impact when we talk about health promotional programs in using sport clubs as a tool. These networks and so on are important. Finally, in this context, you see, really sport clubs activities have great potential, and I really emphasize this setting-based promotion. The settings might be, you see, just like earlier you said, it might be, you see, physical activity promotion, health enhancing physical activity promotion, and health promotion program. However, important that we recognize what kind of theory we have behind our promotional program. And then finally to these guidelines. My key message is these guidelines have to be lead to the evaluating procedure. And if you evaluate it, it means that we really have to have, you see, theoretical frame. And now I return back to the thanks to senior advisor Dr. Pekka Oja in terms of providing us, you see, this kind of approach. It's a question about practitioners' work. However, when we talk about this old instrument or over 100 years old sport clubs in Europe, we really have, you see, have this kind of view that we have this scientific approach to that. here I only emphasize to see when we talk about preparing sport clubs for health program, that there is important is identifying you see the stakeholders' potential. However, when we develop program, I would like to underline you see this that we have really a strategy when going forward in this you see this program, and then when we design program, I return to this crucial point: select and apply theoretical frame for the program, and then the implementing procedure. This organizational structure is important as well, and monitoring. And finally, I come to this evaluating procedure. So, from my point of view, what I would like to emphasize is really, we have to have, when using these guidelines, we have to have, you see, this frame, recognizing concept, understanding nature of civic organization, knowing what kind of health influence special kind of sports have, then emphasizing the importance of social capital, and finally recognizing sport in this hotspot. Okay. Well, actually, this was my presentation. Thank you for your attention.
Thank you, Jorma Savola.